right. This next question comes to us from Zoe, and she's reached out through our Instagram page. Zoe wants to know, greetings, Dr. Kaur. I've got a heart-related question for you. Unfortunately, my father and my second cousin Duncan both have heart disease. What role does genetics play with issues of the heart? Does this make me a likely candidate to develop heart problems? Hi, Zoe. That's an excellent question. And kudos to you for being proactive about your own health and wanting to really make sure that you're healthy. Now, yes, genetics absolutely plays a role in heart disease. In fact, genetics plays a large role in many diseases, some that are not primarily the heart, but that do affect the heart. There have been many studies done on this topic, and while the numbers vary, we know that there's definitely a connection. In fact, there was this one study done at the VA that showed that 35 to 50% of coronary artery disease or coronary heart disease is actually genetic. Now, that's just one study, but it gives you an idea of the extent of the relationship between genetics and heart disease. Also, one important thing to always note is that your risk or your chances of developing heart disease also depend on your personal risk factors. So, are you healthy at baseline? Do you smoke? Do you eat healthy? Do you exercise regularly? Do you drink alcohol regularly? And other types of lifestyle measures like that. Those really have a significant impact on not just your overall health, but certainly your cardiac or heart health. Now, the other thing to know is it depends on what kind of heart condition your family members have. Because if they have heart conditions that are less likely to be genetic, then it's less likely that it'll be passed on to you. So, like you see, it's really not black or white. There's a lot of factors that go into answering this question, and I do encourage that you reach out to your PCP. And the best way to really screen is to talk to your PCP about your lifestyle, your family history, and what is appropriate when it comes to screening for yourself. So all you need is a blood test, sometimes cholesterol check, or sometimes you may need extensive heart testing like a stress test or an echocardiogram. There's a whole bunch that can be done. So I encourage you to talk to your doctor about it and really get your answer personalized to your care.